Jonathan Bodwell, of course, specializes in Medicare and has his own insurance agency. And I read this recently, and I immediately texted John and said, "Hey, can you do a segment on this?" You remember Dr. Oz, Mehmet Oz? He ran for the Senate in Pennsylvania, lost. This is Senator Governor, my mistake, whichever one that was. But he is the nominee for the Centers for Medicare and Medicaid Services. And during his nomination, he said he's going to go after Medicare Advantage programs and mentioned upcoding as a particularly wasteful, fraudulent practice that bilks the federal government by billing 20% higher charges than traditional Medicare charges. I said, John, can you talk about this with a degree of expertise? And you assured me that you could.
I most definitely can. What upcoding is it's basically an exaggeration of services. And that's one of the things that Medicare Advantage is supposed to curb. Because the problem with Medicare, there's a ton of fraud through Medicare.
Yeah.
Original Medicare is just a billing system, okay? Doctors, facilities, they have a billing number. They do stuff, they send it in, government pays them, okay? What Medicare Advantage does is it is supposed to curb that more because everything goes to an insurance company. And if insurance company sees a doctor, performing 20 of the same tests on different patients, they're taking a look. Or if they see, okay, he's got this problem, just like regular insurance. He's got this problem, they're running this test, they're running that test, they're running that test. Wait a second. Maybe they don't need these 3 tests at first. Let's run 1 test, see what's going on and move forward. Whereas if with original Medicare, a doctor will order those 3 tests, run those 3 tests, and the bill just gets sent to Medicare. So ideally what Medicare Advantage is supposed to do is save Medicare money.
However, in Dr. Oz's scenario, he's saying we're wasting 20% of our money.
Exactly. He says we're wasting some money. And Dr. Oz is a huge proponent of Medicare Advantage. He always has been. But he wants to streamline it. Roughly 55% of Americans are on a Medicare Advantage plan versus original Medicare. We do a lot of both. We work with people with Medicare supplements, Medicare Advantage. We educate about all of it. We don't push anybody toward either one. We just want people to know what's going on. But it's mainly it's the exaggeration of what is going on, is what exaggeration of a person's health problem, and next thing you know, there are 3 or 4 tests being run, or there are higher level tests being run, and he wants to be able to cut back on that. He also spoke during the Senate hearing. He spoke a lot about technology leverage, about adding technology to cut down on costs, which is not a new thing in health, but it's something he's a strong proponent of. Not a lot of there are some things that Medicare has not advanced in, and one thing that we get a complaint from a lot of people is Medicare will pay for cataract surgery if it's the old kind of cataract surgery. Medicare will not cover at this point laser cataract surgery.
So they're still doing the small cut in the eye with the scalpel?
They're still doing a small cut in the eye. If you want laser cataract surgery, you have to pay out of pocket, regardless of what kind of Medicare plan you're on. I think Dr. Oz wants to do exactly what Doge is doing and everything else. They want to find every bit of waste. Do I think they're going to cut back on Medicare or services or anything? No. A, because I think they understand that it's important, but B, you always hear saber rattling about Medicare, about Social Security and stuff, but there's one bottom line in America that whether you're a Republican politician, a Democratic politician, or what, seniors are the single largest voting bloc there is. Seniors vote. You can't cut things away from seniors, or your party is the Titanic. He made a lot of good points, and upcoding was his main thing, was them, making a test seem higher level than it is, so there's more money coming back.
When people think of Medicare fraud, I think most people think of fake bills being sent out and paid, fake people being set up to receive money, but that's not the lion's share of the fraud. I think the lion's share of the fraud is more in what Dr. Oz is talking about, upcoding, bilking the government for extra money on something that shouldn't cost as much as it does.
Exactly. Exactly. I mean, the other side of it, there's tons of fraud because Medicare is a billing system. They're not original Medicare. The government is not looking at anything. I mean, every so often they catch stuff, but they just get millions and millions of bills a day, and they're just paid. Mm-hmm. And there are doctors who are billing for tests that were never performed. There are patients that don't exist. There are doctors that don't exist that have filled out a lot of paperwork to get a provider number through Medicare. And that's one of the reasons why Medicare Advantage was set up in the first place, was managed care. An insurance company is not going to let as much stuff go by far as original Medicare because they're not looking at it. Whereas an insurance company is doing just what your insurance company does. You have your doctor says, hey, we need an MRI on this. What's the first thing that happens, Rob?
If I need an MRI?
Yeah, your insurance company.
The first thing they say is, do you have a referral?
Do you have a referral? Yeah. And then your insurance company saying, your doctor needs to fill out this paperwork and send it up to us so we can decide if we agree that you need an MRI. Mm-hmm. Now, overwhelmingly with Medicare, these tests are going to be performed. But just having that one step, that one level of sort of pushback causes doctors to not order fraudulent tests.
So how do you, if you're examining what's fraudulent, what's being upcoded, and you're getting millions of submissions per day, how do you logically and realistically sift through that to find out what actual upcoding is taking place? If Oz wants to eliminate that or cut into it, how would you do it?
On the original Medicare side, it's almost impossible. On the insurance company side, they can cut back on what they're paying, what the government can cut back on what they're giving the insurance companies. The government can say, no, you don't need an average of, $9,000 or $10,000 per Medicare beneficiary per month. You need a little bit less. You have to tighten your belt strings a little bit. You still need to serve the community, but you need to do it at a level where you're making sure the doctors are accountable. And that's what pre-authorizations are. All pre-authorizations are, people are all the time are saying, oh, well, I pay my premium, and they're saying this, they're saying that. You're paying your premium. Premiums are the law of large numbers. I pay almost $1,800 a month for health insurance for myself and one of my sons. It's the law of large numbers. Yes, am I going to get back $1,800 a month worth of stuff? I hope not, because I hope we're never that sick. I liken it to car insurance. Some people say, oh, I pay $400 a month for car insurance. Yes, and you're not hoping, geez, I hope I get my money back from the insurance company. You're hoping I never do. That money, premiums and stuff, and what they're paying in, it's for the percentage of people that end up with catastrophic conditions so they can be taken care of.
But don't we already hear Medicare does not pay enough? Like, hospitals and doctors will say a certain procedure costs a certain amount, and I don't get the amount back that I need to get. So if you start looking at potentially cutting back on some of that, are we going to see doctors or hospitals say, I can't take this?
That's a great question. Hospitals and doctors set their rates. I mean, there's nothing set in stone with them. They've decided, hey, we need this amount of money because we paid, $1 million for this machine, and to amortize it, we have to charge, $3,000 for every MRI. I don't know. I tried to get an MRI last year. It took me 2 weeks to get in to get an MRI. I said, oh, can I get one on Saturday or Sunday? No, we're not. We don't do them those days. We only do emergency ones those days. If you want to amortize your machine, run it 7 days a week. What's the problem? There are so many holes in the medical system. Insurance companies are a problem. Doctors, what they charge used to be a problem. It's not really anymore because insurance companies have cut them back. Lawyers, jury verdicts, stuff like that. The amount of money that doctors have to pay in medical malpractice is one of the reasons they need to pay. They need to charge so much for everything. I mean, it's a triangle. Insurance companies need to make money. You've got the lawyers and the lawsuits. Where I'm not saying there's anything wrong with that. I'm saying if you're injured through fault of your doctor or your hospital, there has to be a recourse. But then you have the doctors and the hospitals who need to make money, and they need to make more because the malpractice insurance is so much higher than it was even 10 years ago. I mean, it's just a triangle of where the American public is not able to to really get everything that they deserve from the system. The whole system needs to be looked at and changed. Medicare is one thing the government does right. I mean, seniors get taken care of. Their health is taken care of. They go to doctors. And I will tell you this, we work on regular health insurance, and we also work on a lot of Medicare. We do a lot of Medicare. We are probably the largest Medicare insurance agency in West Virginia. I talk to clients constantly. Medicare has set really tough rules on these Medicare Advantage carriers. They have to provide at least as many services as Medicare does, as original Medicare does, and then some. They can't provide less. They can't take away anything. They are run on what is called a star rating system, which is like a matrix of about 50 different things that the government rates each plan on. Higher level, if you are like a 5-star plan, you get more money per person from the government on that plan. There's an incentive to do well.
But at the end of that matrix, the UNCAD has the opportunity to potentially put something else in.
111 bracketologists felt WVU was in, and only 27 felt UNC was in. But what I'm saying is there are a lot of checks and balances. There are a lot of safeguards. Medicare Advantage works because if Medicare, if a procedure, if something is needed, and it's in the Medicare system where Medicare says, yes, this is something we cover, and an insurance company pushes back enough, the person can contact Medicare. I rarely ever see a new prescription that somebody gets that's not in the formulary, not added into the formulary when they request it. And yeah, you see some pushback where, okay, this procedure, do this first, okay? Where sometimes some doctors will skip to the third thing where there's a first thing and a second thing they could do to diagnose. The insurance company sometimes will say, well, try this first. Then if you don't find what you need or you find something and you need to go to this higher level test, go to it. But, I mean, there's fraud everywhere, unfortunately.
But the challenge, though, see, my problem with the Doge team is I thought they were going to go in and find waste, fraud, and abuse. But it appears to me more of what they've done is just go in and hack stuff without looking to see who's necessary, what programs actually necessary when we do a forensic study of it. It's just been like a machete. My concern with Dr. Oz's approach, and I like the idea of it, which is if there's 20% upcoding going on, let's find it. But the way you're describing it sounds like it's going to be difficult to find specifically, as opposed to your solution, which was, well, we'll just cut the amount of money we give them back. I don't know that necessarily cuts out the percentage of abuse that's taking place. It just cuts out the amount of money that they can abuse the pool from.
Well, it would make because the insurance companies with the Medicare rules, they have to take care of people. The under 65 plans, there are sometimes stuff gets denied. With the Medicare, they have to take care of the people. I mean, Medicare is one of the strongest agencies. I mean, I don't know if you ever call a federal agency. If you ever call Social Security, you hold an hour and a half, 2 hours. You call Medicare, you're holding 5 minutes. Yeah. The government really takes care of Medicare beneficiaries. If they're giving them less money, that's more incentive for the insurance companies to streamline and make sure there aren't fraudulent things happening. Make sure there's not upcoding. You know, there's so many different ways to upcode and make a procedure seem like it's a more important procedure than it is. Mm-hmm. All I care about is making sure that our seniors are taken care of. And I think Medicare, it has its flaws, but it does a good job making sure our seniors' health care is taken care of. Are there holes in Medicare? Yes. I mean, a lot of those holes can be plugged with Medicare Supplement and Medicare Advantage plans. But the bottom line is, and I listen to Dr. Oz's testimony. Mm-hmm. Okay, it's my industry. I listen to it. What I see is a guy who wants to make things better. I don't see the kind of Doge mentality where, I mean, I've followed some of the stuff that we were sending money to overseas, and I'm wondering why, I mean, who was asleep at the wheel and why they let that money go. I mean, yeah, unfortunately, there are going to be some things cut. And I'm not a huge fan of, I don't believe in cutting federal employees for the sake of cutting federal employees.
Get rid of the inefficient ones.
Get rid of the
slackers.
Go to the supervisors and have the supervisors say, okay, you've got 12 people on your team. How many do you really need to get the work done? And who on your team is not doing the job? And have these supervisors.
That's what Bill Clinton did when he cut back the employees.
I mean, I'm a small businessman. If I have people who are not working out or are not doing the job, I look and I say, okay, this person's not working out, this person's not doing the job, they're out of here. It's not just blanket, okay, everybody who hasn't been here for 2 years, pack up today and go. Some of those people may be better, brighter, and more hardworking than some of the people who've been there for a while.
And have a better technological skill set.
Well, and one of the other problems, and I have some government worker friends, one of the other problems that's going to happen is some of these buyouts and other things where people are sort of being pushed out. The institutional knowledge that's being lost, the people who actually know how to get stuff done and teach other people to get stuff done.
So I want to go back for a second because I know we do this usually in October before you go underground for 2 months. But that is Medicare versus Medicare Advantage and the difference between the two plans. We've got about 5 minutes here if you can give us a pretty good little capsule of that.
Okay, Medicare has holes to it. Medicare itself, hospitalization, Medicare Part A, you don't pay for it. You paid for it through your paychecks. It has a $1,680 first day deductible. That can happen 5 times a year. Medicare Part B, you pay a $257 one time a year deductible, and then it's an 80-20 plan, okay, for the rest of the year. There is no cap to that.
Medicare Advantage is not run by the federal government, correct?
Medicare Advantage is run by insurance companies contracted with the federal government.
Medicare is run by the federal government. Medicare Advantage is not.
No, it is not. They are contracted with the federal government, and they have to live up to the standards of the federal government, the standards of Medicare. The reason you have to have a Medicare Advantage plan or a Medicare supplement plan, unless you're very wealthy or very poor, is that Medicare Part B goes on forever. You have a couple of big chemotherapy episodes. Next thing you know, your 20% is $50,000. There's no cap to it. Medicare Advantage works like regular health insurance, except generally without the big deductibles. Medicare Advantage, you pay co-pays, you pay co-insurance. It generally adds a little bit of dental, a little bit of vision, a little bit of hearing. It works different with your regular health insurance plan. If you're hospitalized, you'll pay $2,000-$3,000 up front as a deductible, and then it becomes an 80-20 plan. Medicare Advantage plans generally have what's called a hospital copay, where you pay, say, an average of about $350 a day 1 through day 5 or 6. Day 1, you're hospitalized. They run tests. You pay $350. Day 2, you have $1 million operation. You pay $350. Day 3, you're recovering. You pay $350 up to about day 5 or 6, and then you generally day 7 through day 90 is no charge. No matter what they do, you're not paying anything. All of that goes into your maximum out of pocket. Chemotherapy on Medicare Advantage is 80-20 like it is with regular Medicare. Plan pays 80%, you pay 20%, but that is up to your maximum out of pockets. The maximum out of pockets range between about $6,000 and about $9,350 is the federal maximum this year. So what it does is it gives you a catastrophic limit.
Which is really the purpose of insurance.
It's the purpose of insurance. It gives you a catastrophic limit. And that's what I am always telling people is the maximum out of pocket. I run into people all the time where they say, well, I have a drug plan. I don't want Medicare Advantage. I don't like it. Well, let me ask you, if you have chemotherapy and you have a couple of other things, and next thing you know, you owe $60,000, how much fun is that going to be? In retirement, it's not like you're going to remake the money. If you do not,
that's a great sentence right there.
Well, I mean, if you do not have a Medicare supplement plan and you do not have a Medicare Advantage plan, unless you are very, very wealthy or you are indigent, you're potentially making a big mistake in that it's all about mitigating risk. That's what insurance is. That's why you have car insurance. Insurance is mitigating risk. If you're fundamentally against Medicare Advantage, call me, talk to me, and I will explain that don't use your plan at all then unless you get catastrophically ill, and then that maximum out of pocket will keep you from spending, thousands and thousands of dollars.
Now, John, free commercial time. How can people call you to ask you more questions?
Bodwell Insurance Solutions, 304-283-0864. And that is my cell number. You will reach me. We have offices in the Aiken Center, BodwellInsuranceSolutions.com. We will help you. We do Medicare education. We teach people to be able to choose the best possible route for their health care.
Good stuff, John. Appreciate it, man. Your knowledge is amazing on that stuff.
Thank you, sir.
And you relate it well.
I appreciate you.